NICE is an international network for knowledge transfer. What we do is put knowledge in the hands of people who can use it. Our members are made up of health and social service professionals from many disciplines like sociology, social work, psychology, law, police, geriatricians, family physicians, nurses, even anthropologists, dentists, and so on. And we also have senior citizens, older people, who have their own committee. They're on our board of directors. And their job is to watch over what we do and make sure we do it right. And we have family members as well, caregivers, who look to us for information and tools about support in caregiving. Our goals are taking evidence-based research according to the standards of the Cochrane and the Camel collaboration, and we make it very simple, straightforward, on small pocket tools that are on paper and will be digitally available very shortly.
We're taking our valuable information that was otherwise not socialized and putting it on the social web and getting it circulated so that we're not spending an enormous amount of time behind the scenes looking to bolster the research around these tools, where we're actually in front of the scene now and front-facing with the public and asking for them what sort of critique they have on our tools.
We have an international network for the collaboration of the care of the elderly, which is called ICE. We have 9 countries. They take our tools and they translate them into their cultural context, and they use those tools just like we do, and then they give it back to Canada, which is very multicultural, and we can use the tools here too. So we're getting the message out all around the world, but it's all of us together.
International collaboration is vital. Whilst languages differ, cultures differ, older people are the same. The older population is growing apace around the world. It's not just in developed countries, it's also in developing countries. NICE is a world leader in ensuring that the knowledge we have about older people is put into practice so that older people benefit.
The NICE Knowledge Exchange is an event that we've had ever since the first year that we came together. We have a number of sessions with speakers talking about new areas that we can move into, and we have a number of workshops that people can rotate through. We have a poster session for the students to get them involved with our network. We really encourage them to come, put up their posters, and we give them a prize.
The knowledge exchange is really where the people receive their training about knowledge transfer. There's workshops about knowledge exchange, knowledge transfer, what it means, how it's done. And I think that's a very different experience for many delegates in being able to be exposed to that end of the research process. We have this research, how do we get it out? How do we get it into action? How do we get it into practice?
We have 7 theme teams. We have teams on dementia, caregiving, ethnicity and aging. We have a new team on law. We have a team on financial literacy and economic security. They bring in special experts from around the world, and they meet together and decide what are we going to do next. And then in the next year they'll work on producing more tools. The end-of-life theme team is a team devoted to palliative care for older people. We've spent a lot of effort on palliative care for young people. We never think about older people, and that their death is just as important as anybody else's.
The End-of-Life Issues theme team has developed 3 tools. One is about capacity on consent towards the end of life, which we think is very important, especially with advanced care planning. The second is what to expect when someone close to you is dying. And that's basic information about what is happening to a person close to the end of life, but also trying to talk to the caregiver and to give information about what you really can expect to do, and also how to take care of yourself, because we think that's very, very important. The third tool we're having is the pain assessment tool, the PAT. And that's a tool that is more geared towards clinical caregivers, looking at pain and assessment and management issues in pain. It's about planning ahead, advanced care planning, funeral planning, but also bereavement care, which we think is very, very important.
Elder abuse has become a serious issue, I think, because the government is focused on it. We do not know what works. We do not know how to end elder abuse. There's a lot of chit-chat out there and lots of information that isn't very reliable or correct. One of the things we have to do is awareness. People need to learn that it's wrong. You can't beat up an old person. You need to know that psychological abuse is quite insidious and it needs to be stopped, and it kills people. My vision for the future is that every older person in the world should be treated with respect and with dignity and be a valuable member of the community.